Nice. Oh no, I'm talking. Yeah. Thanks for organizing. Yeah. I think she got it. Good evening, everybody. I'm Gigi Sharma, and I'm the program manager for Hopkins Institute. Before we go to day one of the Hopkins conference, we are here for a discussion on a very critical topic, that's climate change in health. And the session will explore how US and India can collaborate on effects of climate change in health through policy engagement, research partnerships, and structural development. Without any further ado, we'll hand the mic over to Dr. Gronvall, professor at the Johns Hopkins Center for Health Security, to chair this session.
Okay, great, fantastic. Well, thank you everyone for sticking with us to the end here. And we will, I promise we will get you to the reception, and this looks lovely downstairs with not too much further ado. But I want to talk about, just to open our session. This session is about climate change and how it affects health. As we know, climate change is not a distant threat, or at least as many of us know, climate change is not a distant threat, it is here now. And it's causing lots of different kinds of health effects, everything from heat, antimicrobial resistance problems, rises in different vectors that lead to different diseases. And so we want to have a conversation about what we can do collaboratively about it. And I want to say, just from the outset, I think sometimes my role in panels lately has been to say, like, this is not normal times. And so we are definitely living through a challenging time for the issues of climate and health. And so, you know, but that doesn't stop these from being important issues that need to keep being discussed, and policies advanced when they can be advanced, because they're not, science doesn't change, the climate's not going to, it's not going to go away, these problems are not going to go away. So just to introduce my panelists here, we have Katherine Hadda, who's a senior visiting fellow at the chair for India and Emerging Asian Economics at CSIS. We also have Aishwarya Nagar, who is at my center, the Center for Health Security at in near the Inner Harbor. And we'd love to have you visit us and get installation sometime soon. So just to open this up, the first question, love you to do a little bit of station identification and why you are interested in these issues, how you came to be into this area.
Well, can you hear me? Is this on? Okay, I feel like we're in the karaoke part of it.
If you want to sing, go ahead.
I also want to invite people. I know this could be annoying, but if you want to move forward, because you feel very far away, you don't have to. But even if you move forward and decide to leave, I won't be offended. I won't be offended. But it just seems kind of hard. But anyway, wherever you want to be. My name is Katherine Hadda. I am actually a former U.S. diplomat, and my last and best assignment was as consul general. From there, I saw the power of diplomacy. Obviously, I've been working on diplomacy in different ways for my whole career, mostly on economic and trade issues. But then when I saw the kinds of soft power, for lack of a better word, that and mutual benefit that health diplomacy gives, that's why I became highly interested. Right now, CSIS shop at CSIS specializes in subnational diplomacy. We work a lot with the states, so that was a perfect fit for my experience in Hyderabad, where I work with 3 Indian states, and I lead our health programming, which tends to involve uniting Indian state officials, sometimes central government officials, and civil society, as well as donors.
Hello?
Hello?
Yes. I hear myself now, it's really scary. Hi everyone, my name is Aishwarya, she, her pronouns, and I'm a senior analyst at the Johns Hopkins Center for Health Security. I am originally from Delhi, India. I don't know how I got here, and I'm having a great time at the Center for Health Security, working mainly on global health security, public health preparedness and response, particularly public health emergency preparedness and response, One Health, and right now, a bulk of my portfolio focuses on how do we counter misleading health rumors and information manipulation campaigns. So if that's something you're also interested in talking about, come find me. But right now, I'm working with Gigi and Katherine in the crowd there on a GKII funded project that's trying to understand how India and the US could collaborate at that nexus of climate change and health. So a lot of what I'll be sharing today is derived from our findings. That involved a literature review, talking to a lot of key informants and subject matter experts. Separately, if you think you've got something to say about this topic, come find me. We would love to interview about this as well. So I'll leave it at that for now.
Okay, great. So do you want to say a little bit about what you think, like go into a little bit more about the working at this, not at the national level, but how you can make progress?
Yeah, well, you know, what a lot of people who are not used to working with India don't quite comprehend is how varied the Indian states are and how important they are to the functioning of the country. I mean, we have a federal system also, but we don't tend to have a country where you land in an airport and the language is different and the years of history are different. So they have definitely a strong identity, even beyond what a US state would have. But more than that, it's a federal system and states are responsible for implementing health policy, energy policy, business policy. So if you don't really understand the political dynamics, economic and social dynamics, you really can't get much progress done, even if the national governments are good to go and want to make progress in certain areas. So to me, that's very interesting, but it also offers, and we'll talk about this later, it offers tremendous opportunity even now to build US-India cooperation.
You want to say a little more about what kinds of things?
Yeah, so when I was in Hyderabad, for example, USAID, my friend Amit Chandra is here, USAID, they had a long-running program on TB, for example, which had taken many different permutations over something like 30 years of cooperation. And that included, when I was there, even addressing stigma. We had an event where we addressed the head of the India's only pan-India Muslim party asked us if we could help address TB, for example, in the Muslim community, because there was a lot of stigma there. So there was a lot of great programs around that. And then just specifically on climate, for example, USAID in the last administration was really trying to build climate and climate resilience into a lot of its programming. So that meant, making sure clinics would have enough energy, which invariably meant, looking at renewable energy. So there's the adaptation. How do you make sure that things can still run even if power is cut, if there's a natural disaster, mitigation, about turning to renewables. And you minimize the number of trips people have to make to an actual medical center. So they definitely tried to incorporate it into the.
Yeah, before I go to you, what was the time frame that they were trying to work on with these issues?
Yeah, it would just be, I think, over the longer term, because the fact is that India, even though, and we'll talk about this too, why these issues aren't going to go away is because the government of India doesn't want to. India knows that climate change is very important to its future development. But India is still producing, fossil fuels, is still using fossil fuels. So that's going to increase, use of coal is going to increase. So I think all these things you have to look at as sort of test cases and But I personally spoken to state officials, not in my former orbit, but through my CSIS work, we have a lot of programs with Indian states on renewables. And, if you're off the last mile, beyond the grid, like solar. You have enough for refrigeration for everything.
Right, do you want to give some of the highlights of like what, what you think you've been hearing, or what you think is some of the things that you want the group to know?
We've been having a great time talking to folks from all sorts of sectors about what it looks like to be at the nexus of climate change and health, and what climate change related impacts on health might even look like. And we've heard, collaborations should focus on everything from air quality, heat-related illnesses, extreme weather events, pollution, vector-borne diseases, zoonotic diseases, pandemic prevention, mental health. So there's just so many issues that lie at that nexus that it's kind of hard to pick. But we've been learning how folks in the US have a lot to gain from learning from counterparts in India, who are already innovating and advancing programs, services, policies that try to address some of these climate change related impacts on health. So that's something we really believe in, is a bi-directional. It's not just like this recreating old colonial dynamics where the US is providing the money, and it's really learning from India as well and sharing resources. So there's just so many issues to focus on, and that's great because that means there's a lot of fertile ground for academic partnerships, policies. We, in our work, when we talk to people and we ask what's worked in the past when India and the US have tried to collaborate on this, we've heard a lot about, or we've heard a little bit about some bilateral programs, not really anything explicitly at the nexus of climate change and health, but usually something like clean energy partnerships, technologies. You heard about trust today, so emerging technologies. ISET kind of along those lines as well. We've seen some potential in some bilateral health engagements, like the US-India Health Initiative, maybe integrating climate change into those. But there really isn't any streamlined climate change and health bilateral engagement that we can kind of hold up as an example and say, look, let's try this out. That being said, we've seen so many agency and ministry level collaborations on this topic. We've seen research institutions and academic institutions collaborating with each other across countries on this topic. NGOs and INGOs who focus mostly on program development and implementation, service delivery, technical assistance and support, and then also a lot of private sector innovations that have a lot of potential to be leveraged. So yeah, we're seeing there's no really one gold standard bilateral engagement we can hold up. But I think it's also challenged our assumptions. I admit that my bias was, I was looking for some way that on a government to government scale, there was evidence of some collaboration that we could replicate in the future, but it maybe doesn't have to be decentralized, right? Like the US is moving towards more decentralized collaborations or programming in the US. India is definitely more decentralized. So track 2 engagements, agency, NGO, civil society type engagements. There's a lot of hope there for something that's not necessarily driven by the federal or central governments of both countries, which, as you can imagine, is probably really hard to do right now. So that's what we're looking towards.
I totally agree with that, and I think it's very smart. And I think if there's one, I just want to emphasize this is just very, as Gigi was saying, it's a very unusual time. I don't have to tell anyone that, but it's kind of, when you add it up, if you look at the US right now, stepping away from the global stage on health in a big way, actually, withdrawing from the WHO as of next January, AID closing down NIH grants, we can even mention how important they are, funding all sorts of research and collaborations in India, the financing is going down. So things do look on a government to government level, and then I don't even need to mention about climate change, and the whole walking back, recognizing climate change as an issue. But I do think there's room, just as you were saying, because, if you look at what the strength, I used to say that the people to people relationship was really the secret sauce of the US-India relationship, right? It's kept us together. and growing ever closer as the NRI community is growing. I'm more influential here and people are more interested in India. And so it's always been the case. And so we were talking about USAID and NIH. In reality, the amount of funding that was going to India issues was quite small compared to other programs in the rest of the world. Even AID, I think you'd agree on it, was moving to things like blended finance models, like something called Samarit. We just met someone whose NGO had been funded by Samarit. A way to bring together government money, Indian government money too, private sector innovation. And so we were moving in that direction anyway. And it's my sense, I think I see so many friends in the room, I think you would agree with me that we're getting to a stage where India really doesn't want to be the recipient of all the aid. They see themselves as a leader for the global stuff, but also having something to offer to us, and they definitely do. And so I think Aishwarya, you're exactly right that we, if you look at something like what is important to this administration right now and what is important to the Indian government, what did they mention during the joint statement? Innovation is there. If you think about something like infrastructure, where I've seen incredible things like in Mumbai, high-rise buildings that use a lot less energy. I think if the Indian government, or people, within India with specs, that call for certain, efficiencies. It's not like our businesses or our construction isn't interested in energy efficiency. It is. So I think it may not be directly related to health, but I think that the benefits or AI innovation for heat mapping or disease surveillance, all these things can be applied. They may just have to be reapplied rather than be purpose fit for climate.
Yeah, I think we're getting towards the end. I don't want to keep you full, but one thing that we need to remember is that diseases just don't care. They're very indifferent to national borders. They're very indifferent to you ignoring whether they're there or not. They just keep going. There was transmission of malaria in the States last year, the year before. There's increasing amounts of dengue. I'm wondering when we're going to start seeing yellow fever again. There's a reason the capital used to be Philadelphia, and yellow fever is a big reason why it's not anymore. But I teach a lot of public health students, and this is a kind of demoralizing time for them. But what I try and draw some hope from another time in history where public health there's a Senator Ransdell from Louisiana who kept pushing and saying, public health is important, it's a national responsibility, and we need to work with other countries to do it. And the Panama Canal proved his point, 1918 flu proved his point, but it wasn't, he kept pushing, but it wasn't until a more mild flu came about in the 20s that lawmakers were like, oh, wait a second. 1918, that was horrible. Let's do something about that. And that was when the NIH was created. So there's only one way through, and we can work together on these things to learn from each other, because the problems aren't going to go away.
I'd love to add really quickly that I think that is a very hopeful message, leveraging shared priorities and interests. That's the way forward. Both countries, India and the US, have their own kind of climate change and health priorities. They have their own policies, right? India has, in my opinion, a pretty decent climate change and human health action plan. The US has a climate action plan. I don't know where that'll go, but at least there's in paper shared interests that we can find between these policies, showing how both countries are really interested in better monitoring and surveillance of especially zoonotic diseases and zoonotic spillovers, so emerging threats that come from the diseases we might get from animals that transfer to humans. There's a lot of interest in better data interoperability. So, India has an integrated disease surveillance system, also collecting meteorological data. Can we link those and can we share the learnings? So that's just a national level learning. But there's so many shared priorities we can think about. India is great about I think involving more private sector at the nexus of this issue. The US could really learn from something like that. So both countries have strengths that each the other could leverage, and there's shared priorities that hopefully pave the way for good collaboration in the future. It doesn't mean political will has to align, but diseases know no borders nor political administration, right? Zoonotic spillover is coming, whether we want it or not. Climate change is coming, whether we want it or not. So there's hope here for collaboration.
If I can just add one thing too, because we mentioned the Indian states, but the other thing we at CSIS have found, for example, on electric vehicles, if there's Gujarat designing an electric vehicle policy, who do they want to listen to? Well, maybe the state of Colorado, another state, a US state that's been through the same thing. Or if you look at cities, maybe it really makes sense. They're very different governance wise, but a huge city like Mumbai, what is the what can you teach? So I think the role and the potential for subnational engagement is very strong and in some ways more effective, even because you're dealing with the specific of these localities.
Well, I think in the interest of time, we're going to stop there, but I just have one message for you. H5N1 bird flu is now in Maryland and in this area, so don't let your cats outside. And try to, and don't let your dogs pick up any migratory birds. Stay healthy.
Thank you to our panel, please. Appreciation from our side. And for the audience, good things come, great things come to those who wait. So thank you for your patience. We recommend you all for reception on the 8th floor. There's some delicious Indian food there, an open bar, so and the beautiful table exhibit. So there's no excuse not to come.
Thank you. Oh, do that.